Right now, today is our biggest back-to-school day of the week. At least 19 different districts head back around central Indiana. At many of those schools, teachers, school resource officers, nurses are taking on bigger roles to protect students in this horrible heroin and opioid crisis we're in.
Yeah, and one of the ways that they're doing that is by stocking Naloxone. That's the medication that blocks or reverses the effects of heroin and opioids. Brittany Lewis has been looking into this. Let's talk about this. Are all schools stocking Naloxone at this point?
No, not all of them are, but some that don't are really considering it. I did talk to several districts. Some say they are relying on their local emergency services if there was ever an overdose in school. But in many others, school nurses and school resource officers have it, and it's already saved a life in one district.
The numbers in the heroin and opioid epidemic add up to a challenge for communities. According to the Bartholomew County Chief Deputy Coroner, in the first 6 months of the year, there were nearly 3 times as many overdose calls to the Bartholomew County Emergency Operations Center as there were in the same time frame last year. The number of deadly drug overdoses more than doubled.
It happens often enough in our community that we know that our kids aren't, there's no magic umbrella around them.
Numbers that are hard for schools to ignore.
If we're going to acknowledge that we have epidemic proportion of heroin incidence use problems, how can we how can we not ask ourselves what we need to be prepared for?
So 2 years ago, the Bartholomew Consolidated School Corporation put Naloxone, which is often referred to as Narcan and is used to reverse the effects of an overdose, in schools farthest from police stations and hospitals. Last year, they put it in all of their schools.
Probably in every community, schools are the most visited facility that we have. We have adults, we have families, we have aunts, uncles, grandparents. We have people who come to our schools for all kinds of events, and for us it was we need to be prepared if something happens to one of those.
We never thought we'd have to use it, but I guess you never say never.
That statement proved to be true last year when school resource officer Julie Questenberry used Narcan to save a student's life.
Grabbed the Narcan and ran down the hallway, only to find her passed out in the bathroom with pills scattered about. Judging on what I'd seen there in my training, and I think really common sense prevailed in that moment, where I know Narcan won't hurt her, and I have reason to believe at this point it could actually help her based on what I was looking at. And so I, used Narcan on her, and she came to after a second round of Narcan.
A new law that went into effect last month allows schools to stock Naloxone. It's unclear how many schools across the state have it because, according to a spokesperson for the Indiana Department of Education, schools are not required to report if they stock any, only if they administer it. According to the spokesperson, most schools have not stocked Naloxone in the past, so they do not have any reports about the number of times it has been used in schools.
We have, 2 doses available in all our clinics, even in the lower grades.
But in the last year, Beech Grove City Schools also made the decision to put Naloxone in their schools.
Because many kids, it's not a kid, it might be a parent who's visiting that might be using, and that we have to, step up and help.
Taking on the challenges so many communities are facing.
Districts are also facing other challenges when it comes to the heroin and opioid epidemic. Some districts are seeing more students struggle because their moms used drugs when they were pregnant. The other big impact we've seen because of this epidemic statewide is the increasing number of kids who are in foster care. So coming up in our 8 o'clock hour of Daybreak, I'll tell you how one district is making sure kids who end up in foster care in a different county stay in the district.
Wow, and thanks to the district for being so open and honest about this.
Absolutely.
Brittany, thanks. 6:18 right now. As your official